Hello, Dr. Guy Yatros here from Dental Sleep Solutions and DS3, and welcome to this edition of Dental Sleep Medicine Insider. I know if you've been reading this issue, you're learning a lot about home sleep testing and some controversies about where we should fall as a dentist. I'm not going to get into that in too much detail other than say that the American Dental Association says we should be screening our patients. The latest paper that came out in October 2017 mentions that we are in a best position to be doing these screenings, to be looking at our patients, and as our job we should be doing that. And we should be utilizing home sleep tests as titration methods for patients that we treat with OSA. Now, if we're going to use a home sleep test in our practice, politics and opinions aside, how are we going to do that? Well, there's three ways that I can talk to you about using a home sleep test. One is you can use a traditional method. You can find a physician, either a sleep physician, primary care, other physicians in your area who have home sleep tests in their offices. You can contact these physicians and you can work with them and make arrangements to get your patients tested in their offices. I suggest if you're going to do this that you set up protocols that you both agree on, including what happens to the patients after they're tested. We hope that they'll come back to our offices and we can work together to find the appropriate treatment for that particular patient. So setting up those protocols with the physician on how the handoff goes and what will happen afterwards is very important. If you want to utilize a home sleep test in another method, you might go out and purchase your own unit. And certainly, again, according to the ADA, we should be using these to titrate our dental devices. And there's a lot of home sleep test products out there on the market, and they're all varying and different. Most of them are a few $1,000s, and there's some difference that you might want to look into depending on how many nights it'll record without bringing the patient back in. That can be helpful, whether it actually records body position, whether it records actual sounds of snoring, how much it costs each time you use, how easy it is to use is also important, not only for the patient but for the dentist as well, because sometimes these machines are hard to hook up and sometimes they're harder to interpret and use. No matter which type of home sleep test you decide to utilize, we as dentists cannot make diagnosis on our own. So you're going to have a way to get that information to a physician to be read, ideally a board-certified sleep physician, to get the diagnosis for the patient. Again, I know there's controversy over whether you can do that in your state or not. I'll leave it to the rest of the magazine to battle that one out. Most of the home sleep testing companies that you might purchase this equipment from will help you find these physicians and actually have cloud-based systems most of the time that allow you to go ahead and upload those tests and utilize some physicians that they have in your states to do those readings. So that's two ways. The third way, which actually might be the easiest for some of you first getting started, is you can use a company that's what they do. You can order the tests. We can work with these companies. We have several companies we work with that contact us at DS3 and we'll help you hook up with these companies that basically you refer your patient to. The patient speaks to these companies. They get their health history to them and clarify that they're a candidate for a home sleep test. They ship the home sleep testing equipment to the patient. The patient will wear it for 1 or 2 nights. They ship it back after a board-certified sleep physician has read the data and made a diagnosis, and then you can have the patient come back for a consultation to review those results. Now, the patient typically pays the home sleep testing company directly for that, so it's one of these things that doesn't cost you anything to utilize after you get the system set up in your office. And patients kind of like that because they realize they're going to an outside service and you're not doing this just to generate income in your office. So in my practices here in Florida, we use all three of those methods. We have our own equipment, we work with physicians every day, and we also use some of the home sleep testing companies that we partner with that do a fantastic job of testing our patients. So I hope you're enjoying this edition of Dental Sleep Medicine Insider. There's a lot to talk about. Home sleep testing is changing. We're deciding on where dentists lie in this, and I encourage you to get involved and get educated as to how big this problem is and why we need to be involved in both screening and testing our patients to some extent in our dental practices to help these patients who have sleep disorder breathing, snoring, and obstructive sleep apnea. Thanks again for reading and watching this video on Dental Sleep Medicine Insider. Again, I'm Dr. Guy Yatros from Dental Sleep Solutions and DS3.